Greetings. We are presenting a video titled, Optimizing Vision Accessible Premium IOL Eliminating Dysphotopsia, Glare, Halos with Good Depth of Focus. Distance intermediate and near vision can be corrected by trifocals, but have you ever seen the IOL that works like polyfocal but actually looks like monofocal? The IOL we are talking about is none other than Autofocus Pro, make in India and world's best designed IOL, which is cost effective and is aspheric, ringless, polyfocal progressive. The search for this IOL began when Dr. Ila Kakadiya noticed that a progressive contact lens can correct distance, intermediate, and near vision, so she motivated her husband Dr. Jagdeep Kakadiya to invent an IOL which could functions in a similar way. Dr. Kakadiya, along with his team of Ramesh Shah, acrylic CO polymer in which 74% is hydrophobic and 26% is hydrophilic. 100% hydrophobic preloaded version is also available, and toric IOL will be available very soon. Its large 7.5 mm horizontally oval and 6.3 mm vertical optic covers full visual field, so negative dysphotopsia is absent. Inspired from postal stamps, zigzag serrated outer edges of 6.5 mm L-shaped haptics borders, giving a rock-solid rotational stability by being in complete contact with the capsular fornix, unlike other premium IOL in which only a part of modified C-loop haptic is in contact. It's two dialing holes that needs to be positioned in the upper half of the eye. It has excellent DIN vision, that is distance intermediate, and near vision by GRIN technology, that is gradient refractive index. As there are no diffractive rings, light energy is not lost and no photons are lost. This is the schematic optic, and you can notice that even with different sizes of the pupil, the ratio of distribution of light remains the same. Like varifocal spectacle lenses, progressiveness of this IOL is clearly visible on NIDIC OPD scan. Loops gives excellent rotational stability. The trailing loop in the bag is easy. It decreases the chances of peeing, remains same for any size of pupil, therefore it is pupil independent. As there is no destructive interference or diffraction, angle kappa or angle alpha are of no significance. The different zones of the Autofocus Pro IOL are not visible on retroillumination on slit lamp examination. This is the only ringless polyfocal progressive IOL having all the three zones in the central 1 mm of the optic. Out of more than 51,000 implants in India, not a single patient is complaining of any negative dysphotopsia, halo, and glare. And out of that, more than 90% patients doesn't require spectacles. This is the typical post-operative fogging over refraction versus distance visual acuity chart, and it is evident that from plus 1.0 dioptra to minus 3.5 the vision almost remains the same. This nearly flat depth of focus chart on the minus side is suggestive and indicative that Autofocus Pro IOL behaves like a natural crystalline lens of a teenager after implantation. With this IOL, contrast sensitivity is as good as young adolescent. All the patients with clear cornea and healthy macula and diabetics are fit for this IOL. Autofocus Pro IOL has a great modulation transfer factor of 70%, therefore image quality at retina is as good as monofocal. Like a bullet train after binocular implantation, the average reading speed was more than 200 words per minute without any problem. With crisp and clear vision at all distances without any negative or positive dysphotopsia, Autofocus Pro is also a presbyopia correcting IOL. Most of the near vision intensive vocations become spectacle free and able to read as clear and crisp as a teenager. There is no optical noise as seen in diffractive ringed IOL, hence there is almost no neuroadaptation to multifocality in this lens. Autofocus Pro IOL is the best choice for children as they need only monofocal spectacles for their myopia but no progressive spectacles requirement. Kitchen platform while standing, stair steps while going up or down and below or under furniture. Vision was seen as clear as a child. Easy needle threading in low light after bilateral surgery was easily done. Almost there is no positive dysphotopsias, no glare, no halos, no waxy vision and no photic phenomenon, so it is an IOL of choice in night drivers also. In conclusion, Autofocus Pro is an ideal ringless and novel premium IOL with no negative dysphotopsia, halos, glare, progressive polyfocal pupillary independent PSI, all correcting all types of vision with good reading speed and fit for night drivers with crisp and clear vision. These are my acknowledgements. Thank you so very much.
Very nice. We can take some discussion for the first three presenters, starting with you, Arvind. Yes. I just wanted to know, because I've been also using these lenses autofocus, but how exactly it works? You have to place it horizontally?
Yeah, absolutely.
Yes.
So the design is means 6.3 is vertical and it's 7.5 horizontal diameter is there, and there are two dialing holes are there. They needs to be tucked in the superior part. You will ask why? Because these are position indicators, and why it is able to give, it's a monofocal IOL, how it is giving the distance intermediate and near vision correction. So that is GRIN technology, that is our patented technology, gradient refractive index. So in the superior part, the refractive index is 1.42 and it gradually increases to 1.54 in the inferior most part. So this is how it works, and it corrects all types of vision. And now coming to the most problem is the rotational stability. So in the modified C loop, only a part of tip, few millimeter of that modified C loop is in contact with the capsular fornix. But in this, the L-shaped outer zigzag shaped outer serrated edges are there. So the whole L-shaped modified haptic is in contact with the capsular fornix. So it gives an excellent rotational stability. Coming to the negative dysphotopsia, it is because of the aphakic area 10 to 20 degree in the temporal as well as the nasal side, that is giving this positive as well as the negative dysphotopsia. So what we have done, we have enlarged the size of the optic. It's 7.5. So that's why there is no negative dysphotopsia, and now the implantation is more than 1 lakh in India, and not a single patient is complaining of negative dysphotopsia. And halos and glare are not there because there are no refractive or diffractive.
What will be the size of the rexis?
Sorry?
Rexis size?
13 millimeter hole.
Rexis.
Sorry?
Capsular rexis. Capsular rexis.
Capsular rexis, yes. Even in a smaller rexis, 4.75, it goes very easily. No problem.
So it's pupil independent?
Pupillary independent. We can put it, we have put it in traumatic mydriasis cases, Uret-Zavalia syndrome, and the patients are doing well. Even I implanted in my mom's eye both the eyes one month before.
So like, have you faced any limitation in any case, like anything which you want to comment? Like
limitation.
Limitation.
Yes.
Any
limitation. A limitation is if you have astigmatism of more than 1 diopter.
So
right.
toric is not available.
Toric is it's already ready. We are doing the clinical trial. Within 3 months, it will be available. Toric. So number one is that thing, and if the macula is not healthy. Right.
And have you placed it in one-night cases also?
Yes, of course, of course. One night, the other eye, they have other premium trifocal, and now they are
only one night case.
Yes, of course, yes.
Okay, thank you, sir.
Thank you.